realized that millions of babies in our country used to die 10 years ago or 15 years ago. But now, due to the excellent programs, both from the government in terms of Janani Suraksha Yojana and Rashtriya Bal Swasthya Karyakram, and also in the private sector, all these babies are surviving now. A lot of good survival rate has happened in even the remote and tribal areas. Blindness in newborn babies in those communities is very challenging because there's no skilled manpower there, the awareness is not there. And how do we reach out to these communities in a very efficient and excellent manner, in a highly standardized way of caring, without too much burden on the finances and economics and the environment in those communities?
So we are in Bhadradri Kottagudem district. So it is the aspirational district in Telangana. We work for primary health care. So we have two areas focusing. So one is I Do Health Center and other is outreach program through mobile medical clinics. So the population is around 12 lakhs population, and nearly 40% are tribal population here. So there are nearly 130 hamlets which we are working, where there is no access to the primary health care. We have come up with a program, mobile medical, to provide the primary healthcare services to the tribals who are residing interior in the forest. So we came up with a program called MMU. So this MMU will help in bridging that gap. So wherever the patient is not able to come to the center, there the MMU is going to the center and providing doorstep primary healthcare services, focusing more on mother and child. So this program is very useful because majority of the tribals who are located remotely, they doesn't have access to the primary health center, which might be some 20 to 35 kilometers away from their hamlets. So this program, taking the healthcare to the last mile, will be very useful in this kind of geography where there is a lot of challenge to reach.
So what we have done is we have designed a program which will be embedded within the communities. So it will be the healthcare workers in the communities who will be trained to do the basic eye screening, so that for basic eye screening, health screening, the parents and child don't have to travel anywhere, and nothing from outside needs to come in except for basic training and the skills and a very basic low-cost equipment which is not dependent on batteries, but which can be charged with solar light in most areas.
Several years back, we started a CSR sickle cell anemia mission where we developed a novel test. And this test is a molecular test, making it the most possible robust test. It takes only one drop of blood, and that also on a small piece of paper, which once dropped is stable at room temperature, can be transported, thus obviating the need for any intravenous blood sample collection or transport and big infrastructure collection. Most important is that this test can be done on any individual, irrespective of gender, irrespective of age, right from newborn to even a pregnant woman as well.
Previously, the children would come only when they had very advanced disease, many times which we could not even treat. But now we are able to give that health card to the mother and the parents that the eyes are healthy or they are not healthy, and if they are not healthy, what we can do to immediately treat it so that the disease can be prevented or it can be controlled before it has caused havoc inside the eye. So the intervention is also being done on the bedside in those remote areas. So our team goes there with lasers, injections, whatever is required, and treats. Those children who can be managed with teleconsult, they are being managed with teleconsult so that the parents don't have to travel far. When the disease becomes advanced, then these strategies will not work. Then all the children will have to come to tertiary center and the outcomes will not be good. So I think treating the babies, screening the babies right at the doorstep where they are born, and then keeping an eye and vigil on them as they grow into the next 6 months, 1 year, and 1,000 days, critical days of their birth, I think it makes a huge difference to the eye, vision, and the overall development of the child in those remote areas.
We have actually not only provided access to healthcare, but also given injections and also insulin injections. We provide glucometers and strips, and we actually conduct all tests free of charge for these children. We give nutritional advice, and the advice is such that these children can actually use, whatever they are usually eating can be modified so that their diabetes can be controlled. Since the Tata Trust has stepped in, we have been able to expand our services to more number of children with poor access. We are able to provide insulin, glucometers, strips, all the other medications and testing that these children require. Plus, we are also able to provide nutritional support to these children. Many of these children need supplements, which we are able to provide. Because of our support that we get from the Tata Trust.
Baby was found to have stage 3 ROP progressing into stage 4, and we immediately got the baby from Produttur to Kadapa, and we immediately did the laser, and we could able to save both the eyes, and baby is doing well. This is one such example of our success in our Endless project, where we are able to screen other neonatal eye condition. More notably, recently we were able to diagnose macular retinoblastoma, and we were able to start chemotherapy as well.